Good morning once again, everyone, and thank you for joining us for our webinar, HIPAA Security, Risk Analysis, and Assessment. Presenting today is Steve Spearman, Founder and Chief Security Consultant for Health Security Solutions. Steve has been employed in the healthcare industry since 1991, when he began working with patient care technologies, an electronic medical record solutions provider. As Chief Security Consultant for Health Security Solutions, Steve stays busy providing HIPAA risk analysis for clients and business partners. He is a sought-after speaker and expert on HIPAA and information security. He has spoken and provided remote webinars for several state chapters of the Health Information Management Systems Society, including Colorado and South Carolina chapters. Steve is also on the HIMSS Risk Assessment Working Group. In addition, he has spoken at both regional and national conferences of the Medical Group Managers Association. We are pleased to have Steve join us this morning, so without further ado, I'd like to turn the presentation over to Steve and get started.
Sounds great. Jacob, can you hear me okay?
Yes, we can.
Okay. Welcome, everybody. And again, my name, thank you for that kind introduction, Jacob. This is Steve Spearman, or is it Eric? I appreciate that. So, but I'm Steve Spearman. I'm with Health Security Solutions. I do want to actually cover today, just sort of kind of review what we're going to be covering. So, as was indicated, we're going to be talking about risk analysis, but I'm going to be doing it in the context of talking about compliance. And I actually have another presentation that I give called HIPAA 101. I would recommend that you check out that webinar. Give it about once a month, and you can find it at healthsecuritysolutions.eventbrite.com. That's BRITE.com. And in that presentation, we actually go more deeply into the security standards. We are going to be looking at those today, but more at a high level than we do in that presentation, and it's actually worth checking out. But I appreciate the opportunity to be here today. We're going to start off with a very basic question. What is HIPAA? It's sort of like you've probably heard of Vince Lombardi every season holding up a football and saying, this is a football. So we're going to really start with the basic question, is what is HIPAA? I actually want to point you to point number 2, first of all. HIPAA provides these rules for data interchange. In other words, that when a company, let's say a clinic, sends a claim to an insurance company, HIPAA in 1996 established the standard for that information, like how it was sent and how it would be received. It's in a sense like an interfacing standard. And this was actually what HIPAA was initially supposed to be all about. Then they loaded some other stuff about bullet number 1 with things related to you know, being able to qualify for coverage when you have a change in your employment status. But somebody somewhere along the line said, hey, why don't we add this stuff about security and privacy? And they did. And of course, now when we all think of HIPAA, that's what we think about, is the security and privacy provisions. And specifically, and that's of course the part that I focus on, that we're going to focus on today, but I want to actually draw out some distinctions between privacy and security. What's different in the rules about them? They are different subsets of the regulations. The privacy establish broad rights of patients over their information, how it can be used, how it can be disclosed, and what can be disclosed. And by the way, this is not a rule that, you know, their rights trump everything else. You know, the general way to think about it, it is your data, you own the data, but they have rights as to how it can be disclosed. They have the right to get a copy of that data if requested. The privacy rules establish things like minimally necessary. You can't divulge more than what's required for whatever the function is that's being performed. On the other hand, a patient can't say, well, I don't want you to disclose, you know, this information if it's for purposes related to treatment, payment, and operations. So it would include things even like how it can be disclosed. If a patient says, I only want you to talk to me about my care by calling my mobile phone, you have to actually honor that request. So those are the privacy rules. They're broad rules that establish the right, patient's rights to the disclosure of that information in all its forms, verbal, written, and electronic. The security rules are specifically focused on electronic, and specifically electronic protected health information, and it establishes administrative, physical, and technical safeguards. And specifically, 3 areas are addressed in the regulations. Confidentiality, which is what most of us think about when we think about HIPAA. In other words, keeping private information private. But it also involves integrity. That means that make sure that data cannot be inappropriately altered or deleted. As well as availability, making sure that the data is there when you need it. And as we go through the standards over the next few minutes, you're going to kind of see that the standards, tend to focus on 1 or maybe 2 of these at a time. So we'll think about this: CIA, confidentiality, integrity, and availability. Now, this is how the rules are structured. They are divided into standards and into implementation specifications. In this one, this is actually the very first HIPAA security rule standard. It's the security management process. And then the rules are, most of them, but not all, but most of them also have what are called implementation specifications. So this rule has 4 of those: risk analysis, risk management, sanction policy, and information system activity review procedure. And those rules are either well, first of all, back up. The way to think about the standards is just think of them as all the standards are required. You have to do something related to the standards. And for most of the rules, the way that you should address or think about addressing those standards is through the implementation specifications that are published under the standard. Now, for our purposes today, we are going to we're going to call the implementation specifications safeguards, just because it's not as much of a mouthful to do that. By the way, Eric and Jacob, I just want you to know if you lose me, let me know. I may be having some battery issues with my headset. But if you lose me, let me know.
Okay.
Then so there are also a category of safeguards that are called addressable, and we want to talk a little bit about that. The addressable safeguards, do not think of them this way. They are not optional. It does not mean they're optional. It means it's based on a legal standard called reasonable and appropriate. Reasonable and appropriate basically means you have to do the following. You have a positive responsibility to determine whether an addressable safeguard is reasonable and appropriate, and if it is, then you must implement it. If it is not, then you have some options related to its use. So that's the right way to think of it. They're not optional. They might be optional after you determine that someone is not reasonable and appropriate. So how do you determine what's reasonable and appropriate? Things like the size, complexities, and capabilities of the covered entity, the covered entity's technical infrastructure, hardware, software security capabilities, the costs of security measures. So nobody expects you to spend $1,000 to fix a $100 risk. And then lastly, the probability and criticality of potential risk to EPHI. And there's another one that I would add to this list as well, and that is like the sensitivity of the data. If you have a practice, maybe you're a psychiatrist and you're a one-man psychiatrist, your practice is called the Shrink to the Stars. So you're a small practice, but you've got highly sensitive information, mental health information on famous people that many people would like to get their hands on that information. So for that reason, we would recommend that you would need to do some extra steps to make sure that data is secure. So what are your options for addressable specifications? Obviously, you can implement the safeguard. You could implement an alternative, and I'm going to talk more about that later when we talk about encryption. We'll get into that as one of our examples about the right way to think about it. Or you can choose not to implement it, but especially for those last two, you need to document your decision. You have documentation supporting why you chose not to do it. So there are three types of safeguards: administrative, physical, and technical. Administrative are the organizational rules. They govern people's and staff and organizational behavior. Most of the safeguards are administrative. 23 of the safeguards are administrative. Physical standards are things that where you use physical objects or how physical objects are oriented to protect things. So a key is a type of physical security measure. And so we'll talk a little bit about that. And then technical are software, appliances, hardware, other things that you put in place to help protect information and processes. So administrative safeguards specifically are defined as the actions, policies, and procedures to manage the selection, development, implementation, and maintenance of security measures and manage the conduct of the covered entity's workforce. These are the standards, and as I said, I do give a presentation where we go into each of the safeguards, but in this presentation it's high level, and so we're going to talk them in more general terms. The security management process has 4 standards that we saw earlier: risk analysis, risk management plan, sanction policy, and information system activity review, that together are your security management process. So as an example, risk analysis, those are all required safeguards. Risk analysis is something that you have to do. We're going to reference this more deeply later. But an information system activity review is another one. You have to have a procedure where you can go in and see who's been doing what within your system. If you have let's say if you're a hospital and you have a famous patient that's admitted to your hospital, you may want to review who was looking at that chart because that access needs to be appropriate. So the next standard, which has no safeguard, it stands on its own, is assigned security responsibility. So you have to have a named security officer. Cannot be an employee, it cannot be a committee, cannot be a department. It has to be a named individual. Workforce security covers hiring and firing. So, or really, processes that ensure that you have the right people on board, and then processes, for example, to terminate the access to protected health information. Often, usually the context is termination from employment, but in these security rules, they're primarily determined making sure that they don't have access to information. So there might even be a scenario where you would invoke some or all of your termination procedures because somebody got promoted and they don't need access to protected health information. And then information access management is, hey, we've gone through the trouble, we have good people on board, now now we need to grant them access to that protected health information. And while I'm talking about, hiring, firing, this is one of my favorite cartoons. It's Dilbert. He says, what a day I'm having. First, my key card doesn't work, so I have to tailgate into the building. Then my network password doesn't work. Now my voicemail doesn't work. Is it possible for anything else to stop working today? So here, the procedures are actually, good. I mean, they cut off his key card, access to the building, password, voicemail. They just failed to tell him he had been terminated. So maybe that needs to be added to the list. Then security awareness and training. Security awareness and training is a really important part of the rules. In the safeguards, they define 3 categories of things that you want to talk about, like login and password management, etc. I think that list is just a starter list of the things that you need to cover. But when it comes to training, I have 2 reasons why I think it's really important. One is practical, the other is cynical. The practical one is that training is maybe the only thing between you and a breach. Your employees need to know they should never ever, for example, share their password with anybody ever. And so just because that person on the phone knew your Aunt Maud in high school and is claiming to be computer support does not mean he needs your password. So and then the second one is cynical in the sense that you know, if you have a need to terminate an employee, you do not want them to be able to make the claim that, oh, well, I didn't know I wasn't allowed to do that. You want to make sure that your training adequately covers what you expect of your employees, and so it really is important. In my opinion, though, possibly the most important standard is the next one, security incident procedures. And by the end of this presentation, the reason I think it's so important will become evident. It's really important because you're going to have to need a way to document incidences that happen. And if you don't have that method for that in place, then you don't have a way to deal with them or to demonstrate compliance if you're ever audited. So you have to have a way to report and to respond to security incidences. Contingency plan is basically data backup plan, emergency response, disaster recovery, and other elements related to availability of information. You have to have an exact reproducible copy of your protected health information, and that's covered under the contingency plan. The evaluation standard, no safeguard associated with it, is that you have to evaluate your security periodically, and probably the most important way you'll do that is through risk analysis. So periodically you should do risk analysis, and it's also important to think of this when you're considering any major changes to the organization, maybe new software, maybe building out a new building. You want to sort of step back and say, what is the potential security impact of those decisions, and then document those. Business associate contracts is a requirement under the rules that where you must have a type of contract in place to make sure that vendors that are not providing care but otherwise need access to PHI, you know, they have to be governed under what's called a business associates agreement. So the physical safeguards are physical measures, policies, and procedures to protect a covered entity's electronic information systems and related buildings and equipment from natural and environmental hazard and unauthorized intrusion. So there are 4 standards here. Facility access controls is things like locks on doors, and you know, should you consider actually getting like key fob access to be able to even track who goes through what door at what time. It's those kinds of issues, and you know, includes things like maintenance, making sure that when you're moving equipment that you're properly documenting the movement of equipment. Workstation use and workstation security are both standards with no safeguard, and they basically say, what do we do to make sure that our assets, our workstations, our laptops are secured so that they can't be stolen, they can't be used in a manner that's that could compromise security. You know, this standard might, you know, would drive many organizations to have a policy that would say, you know, that would govern the appropriate use of, you know, company computers. You may have a policy that doesn't allow Facebook or social you know, networking, and you know, it would. I'm not, by the way, saying that that's what your policy needs to be, and there is, you know, there's reasons why you might want to allow it. But as an example, those gets to that is something that gets to the issue of appropriate use and security of your computers. So device and media controls is a standard that exists because everywhere that ePHI exists, it exists on media, whether it be on a thumb drive or on a RAID array in a server in a data room, in a data center. And so it sort of is like it's a little bit of a catch-all, and it covers specifically things like disposal. You want to make sure that your data, that you have a means to properly dispose of information. It covers things like backup. One of the especially in the early days, but one of the most common high-risk findings that I found when I conduct risk analysis was related to the use of external hard drives. So people were using those for backup. They were rotating them once a week. The data was not encrypted, and it was in a huge security risk. If that backup were lost, you'd have to declare a breach, and it has all your data. It's not going to be a small breach. So that's covered under the Device and Media Control Standard. And then the last standard is technical safeguards. And one of the things to note about the technical safeguards is that they hang together. You know, access controls is related to authentication, which is related to integrity. And access controls, for example, has a unique user ID requirement. That's one of the safeguards. You are not allowed to ever share your password when protected health information is involved. That last bit is an important caveat. It might be appropriate in some settings to allow shared passwords at the network level. It might be, but at the application level where protected health information is involved, you are never allowed to share passwords. Another one of the standards under access controls is encryption. By the way, the passwords, unique username is a required safeguard, but there's also an addressable safeguard under that one, encryption and decryption. We're going to talk more about that one, and I think it's important to note, make a mental note that that is an addressable safeguard, but the reason it's under access controls is that anywhere you're using encryption, there has to be an access control that encrypts and decrypts the data. So I actually was once told by somebody where I had her laptop right in front of me, and she swore that it was encrypted, but it booted all the way up to the desktop and never asked me for a username. And I knew that it was encrypted. They may have installed encryption software at one point, but somebody had clearly disabled it, because you know there's not encryption if there's not some sort of authentication or access control. So, but we're going to talk more about encryption later. Audit controls mean you have to have ways to make sure that when you do have audit logs, that you have a way to protect your information audits, your information system activity audits. And so you don't want to put that on just any open drive on your network where somebody could go and delete those logs or maybe records out of the logs. So you want to make sure that you maintain controls around that. Integrity means, again, you want to have a way to make sure that no one can inappropriately alter or delete information, and that you can track whatever anybody does. So that's, again, related to access control and authentication. And authentication, there is, the main way that people authenticate in healthcare is through a username and password. But I am actually strongly encouraging my clients to look at more secure methods of authentication, like single sign-on authentication with a key card and maybe a PIN, or even biometric authentication. I think can be very, very valuable in healthcare. Doctors really dislike passwords, and there is a way that you can totally eliminate passwords in your environment and increase usability and increase security at the same time. And so, that's something that's worth looking at. And there are solutions like Indigo IdentityWare that allow you to do that. Transmission security would be transmission of data in motion, and it has integrity, making sure the data gets there, and encryption. Again, both of those are addressable safeguards. But this really, one of the areas that this ends up, playing into is the area of email and text messaging. Many people like, a lot of physicians really like text messaging, but it needs to be done in a manner that's secure. So here we're going to transition now to the whole discussion about compliance. And before we get into that, I actually want to talk about principles of risk management, like what are your options when you're thinking about compliance? What can you do about the things that you identify that you need to do and the risks? And I'm going to use an example of, think of an 18-year-old rock climber. And this rock climber happens to be a free climber. He doesn't use belay lines or ropes. And he's a world-class rock climber. He loves it, and he's famous and has accolades and all that. So And then imagine that 10 years later, he's now 28, he's married, he has 2 kids. In that scenario, the way he thinks about risk might change. The way he thinks about risk might change. Hey, Jacob and Eric, can y'all still hear me?
Yep, we can hear you, Steve.
Okay, sounds good. Thanks. So, so the way that he thinks about risk would change, right? So what are his options? One is he can avoid the activity. He can say, I am no longer going to do rock climbing. He can reduce the risk by choosing to start getting a rope and using a belay line, and that's the only way he's going to do it. He could transfer the risk, and one option there is he could get life insurance. If he could find life insurance, he could get life insurance, and if he has an accident that leads to his demise, he would, you know, his family would be taken care of. And then the last one is accept or assume the risk. That means we're not doing anything. I love this too much, you know, and I hope I don't have an accident. And those are all kind of options as you think about what you should do with your compliance program. I do want to add that I want to kind of go into the elements of an effective compliance program. And what I want you to note is that each of these has its corollary in the rules. All but one we've actually talked about, and I'll get to that in a minute. But leadership, there needs to be a commitment to leadership to compliance and doing what needs to be done. And that should be an executive level leadership. Its corollary in the rules is the security officer requirement. Somebody needs to kind of have the authority and resources necessary to make sure that data is secured. The second one we really didn't talk about because I'm going to talk about it in a minute. It is covered in the rules, and I'll get to that slide in just a minute. Risk analysis, obviously, is the very first security safeguard. Is you have to understand what needs to be protected. Education and training, obviously, the security awareness and training standard. Monitoring and auditing. So we talked about the need for information system activity review and audit controls in place. Response and reporting, incident response, and then enforcement would be covered under the sanctions requirement within the rules. So I'm going to illustrate the whole idea of compliance by using a little bit of an analogy or, you know, a situation. Imagine that you're being compliant, that you're being audited. So an auditor is right there in front of you, and he's asking about what you're doing and how you're doing it. And so he sits down across the desk from you, and he says, okay, show me your sanction policy. Okay, so the rules require you to have a sanction policy. If your answer is, I don't know what you're talking about, then this is going to be a hard day, and you would be non-compliant. Now, by the way, there are not 4 categories of compliance. It really kind of exists on a continuum, but for illustration's sake, that's what we're going to go with. This is going to be a hard day. You're going to fail your audit. You're non-compliant. You don't have anything. So you don't want to be there. You definitely don't want to be there. So the second level is you're compliant on paper. So he says, let me see your sanction policy. You turn around, you get a 3-ring binder off of the bookshelf behind your desk, you blow the dust off of it, you open it up to the sanction policy. So you're compliant on paper. And that's better than not having anything at all. So one thing that he may ask, though, is like, well, have you had to sanction any employee? Have you had to discipline an employee for anything related to HIPAA? And if your answer is yes, you know, you may then go on to describe what you did. Well, we put something in his permanent file, and, you know, we did this, we did that. And maybe those things you didn't document. So you complied in practice, and this is assuming you had went and looked at what needed to be done. Probably didn't happen, but you know you had an informal procedures that you practiced, and so again, that's better than number 2. If you can't even talk to anything you did, you have no idea what you did, you're pretty sure you kind of did something, then you know, but you're not sure, then that's better than saying we didn't do anything. So, but really where you want to be is 4. It's compliance that's documented and can be verified and proven. So, and this is where I'm going to talk about the documentation requirements from the rules. These bullet points come directly from the regulations. And this is what they require. In order to comply, you have to implement reasonable and appropriate policies and procedures to comply with the standards. They have to be maintained in a written form. You have to maintain a written record of the action, activities, assessments, logs, reports, audits, etc., that documents your compliance. Those documents have to be kept for 6 years. They have to be made available for those that the documentation pertains, and then you have to periodically review the documentation. And so, in a nutshell, compliance is having written policies and procedures that are mapped to the regulations, because remember, you have to have a policy governing each of the regulations, that reflect the findings of your risk analysis, and that will become why that's true, will become true, you'll understand in a few minutes, that are followed and can be proven via a paper trail of forms, reports, logs, etc. So let me give you an example. Imagine that you need to terminate an employee. So what do? Well, what you should do is follow your policy and document through checklists or whatever forms that you have. So I actually, for my risk analysis service, I provide security policies for everybody. Even if you don't need them, we still give them to all of our clients as a value add. And so in our policy, this is the map that we have. And you now need to terminate an employee. So you go to the termination procedure standard on the right, and you kind of look, well, what is the policy that governs what we need to do for termination? So you pull out the system access policy and you read the process, and lo and behold, it tells you what to do, including how to document your compliance. So you have a termination checklist, and you say the date of the termination, was it voluntary, non-voluntary, make sure they turn in their badge, that you cut off their access, and you complete this form. And through this is what you do to prove through audits, reports, logs, forms, etc., that you've complied with the regulations. So that's kind of the right way to think about compliance, and you need to have ways that you can document how you're fulfilling these requirements. So now there are two big gray areas related to compliance. One is addressable safeguards based on the reasonable and appropriate standard, and the other is the risk analysis findings and results. And what we're going to do is start with number two. We're going to start with talking about risk analysis and why it's such a critical component of compliance and about following the rules. The HIPAA rules specifically say that you must conduct an accurate and thorough assessment of the potential risks and vulnerabilities to the confidentiality, integrity, and availability of electronic protected health information. And it's worth noting that meaningful use invokes that exact same verbiage. So if you go look at meaningful use, it says conduct a review, security risk analysis per 45 CFR 164-308A1 and implement security updates as necessary. Now this is stage one, and in a few minutes we're going to talk about what stage two does. It has the exact same language, and the thing to note is that cryptic code in the middle, CFR stands for Code of Federal Regulations, and it actually points to that very first HIPAA standard we talked about, the Security Management Process Standard, and of course the first safeguard is risk analysis. So basically the thing to take away from this is that meaningful use risk analysis and HIPAA risk analysis are the same thing. When you're conducting a meaningful use risk analysis, you're also complying with what HIPAA requires of you. So I want to talk a little bit about the differences between stage one and stage two of meaningful use. So under stage one, the security requirement was either 14 if you were a hospital or 15 if you were an eligible provider, and it was the language that I just read to you. In stage two, it's core requirement 9 or 7 for hospitals and eligible providers. And it says the same language, conduct a review, security risk analysis per blah, blah, blah. And including addressing the encryption security of data stored in your certified electronic health record in accordance with requirements under 45 CFR 164312 and 45 CFR 164306D3, and implement security updates as necessary and correct identified security deficiencies as part of the provider's risk management process for eligible hospitals. So it's added some of this language here. And what I want to note, we're going to actually kind of break this down a little bit because there's been a lot of confusion about meaningful use and encryption. And in fact, people saying, well, the meaningful use requires encryption everywhere, and it really doesn't. And let me kind of break this down. So here's some thoughts about this rule. One is that first reference to 312 is to the technical standards that we just reviewed, and is specifically the encryption and decryption safeguard of the access control standard. So in other words, it's not changing that at all. It's just referencing what the HIPAA rules require, which it's still an addressable safeguard. And in fact, that addressability is actually in that meaningful use language, because that's what's invoked in 164306D3. It basically saying, consistent with the addressable requirements, you need to think about encryption consistent with the access control standard. So the main point that I make is that the biggest burden for Stage 2 related to encryption is really on EHR vendors, because the government added certification requirements around encryption to them, and basically it said that EHR vendors, if some of you have your Stage 2 software already, then that software at the database level was delivered to you in an encrypted state. That was what was required under the rules. That has to be the default state of the application. They also made it so that the software requires administrative level privileges to disable encryption, and it also so in other words, it even lets you disable it, but it has to be done in an administrative level. Just a standard user can't disable encryption. And so the real burden or language is really on the vendor side to make sure that it's delivered consistent with the certification standards there. And by the way, it does add this language around risk management, and remember, it's under that standard, and the second safeguard is risk management plan. And so, consistent with your security processes, you need to look at encryption. So why is security risk analysis like the very first HIPAA rule? Why is it in meaningful use? And I'm going to cut through all these bullets and just sort of say it's kind of like having your house inspected for sale. And it's probably many of you have probably had that done, or you bought a house and you had it inspected. And the thing about having a house inspector is you have a guy come in that looks at all that stuff that you walk by every day, and you don't notice that hole in the sheetrock anymore because you see it every day and you walk right past it. And you have somebody that has a methodical process to look and see what's going on with your house. And that's really what a security risk analysis does. It's sort of taking inventory, figuring out what's going on, documenting it. And my point is that unless you do that, you're just guessing. You just are hoping, winging a prayer here that nothing goes wrong. And under the rules, you're not allowed to do that. You actually have to actively, get that inspection done so that you really know what needs to be done. So a risk analysis should identify the assets by IT assets, I mean computers and other assets that touch electronic protected health information. They really should document the flow of information into the organization, what's created within, how's it flowing out of the organization. It should determine your policy compliance through regulatory map. It should identify and categorize the risk to the confidentiality and integrity of EPHI, and it should recommend and rank standards and controls for remediating, mitigating, and managing those risks. So how do you conduct a risk analysis? It could be, what's interesting is the rules don't say, the actual regulations don't say, but what is consistently referenced in multiple government documents is the NIST guidelines on risk assessment, specifically Special Publication 800-30 Guidance on Risk Assessment. And it's not the only way to do it. There are other frameworks that are available, COBIT and ISO and others that provide guidance on these things. But the NIST is a pretty good standard to meet because it's the one that it's the federal government has to actually comply with the NIST framework. So it's a pretty good one to look at. There's also another one called 866 that provides some really useful data. Then a couple years ago, they published the audit protocol. It has not been updated since the omnibus rule last year, but it's still very, very useful. That gives us some ideas. And then in many ways, one of the more important things was the Office of the National Coordinators. That is the department that's overseeing the Meaningful Use Program, published a guide to privacy and security of HIT, and especially myths and facts. It's on page 11 of that. And one of the follow-up items that we'll provide to all the attendees today is that ONC guide. It's very useful, and go to page 11. This is not the complete list. There are actually 13 myths that they debunk, but this is what I thought were the highlights from that. It is a myth that it's optional for small providers. Everybody has to do it. Installing a certified EHR is not enough. You have to basically look at all the risks to PHI and know your EHR vendor is not handling this. It is the eligible providers or eligible hospital's sole responsibility to conduct risk analysis. A checklist will suffice. No, they're useful. I use them in my own practice, but they by themselves do not constitute a risk analysis. And what most people tend to do is they'll use a checklist that's sort of compliance related. And again, that can be useful, but it doesn't help you identify the risks. They only need to look at the HR, and in this document they say everything needs to be looked at, including things like copy machines, and that's actually talked about in the ONC guide. And last year, some of you may have heard about the Affinity Health breach that involved them giving some copy machines up for lease, and one of them was released by an NBC affiliate who did an investigative journalism piece on the data on those copy machines. So you need to look at all the assets. Computers, servers, copy machines, iPads, iPhones, iPhones, other smartphones, things like that. Another risk is that you have to outsource your risk, or myth is that you have to outsource the risk analysis. People that have the resources and expertise can do their own risk analysis. But in that same document, they basically kind of encourage people to look at outsourcing it. Select a qualified professional to assist you with the security risk analysis. And this is because it's the same reason you hire an accountant or an attorney. It is something that generally expertise really is helpful. So this is the NIST process diagram from that 830 document that I told you about, preparing for risk assessment and then the steps to conduct it. And specifically in preparing it, you need to define what's the purpose, what's the scope. The scope is like, what are we going to look at? What are we going to not look at because, it's not appropriate? We're going to define those things. What are the assumptions and constraints? Those could be related to it could be a budget constraint or another kind of constraint, but how you're going to go about conducting this. What are going to be your sources of information? So are we going to use tools to gather information like scans? Are we going to do interviews? Are we going to do, usually it's going to be a combination of different methods for, it could be policy review. All those things kind of come into play. And then what's our risk model that we're going to use? And then conducting it is you identify the threat sources, the threat events, what are the vulnerabilities that are associated with that, determine the likelihood and the impact, and then determine the ranking based on those two factors. And we call these the vulnerability pairings. So you want to look at what's likely to occur, and if it does occur, its potential impact is high. And really, from a risk process standpoint, you're going to want to focus on the high findings, the things that are likely to occur, and that if they occur, it's a bad year for you. And in my earlier example, when I talked about external drives, that were unencrypted and that were being rotated off-site. That was an example that always was a high finding when we conducted risk analysis. So what are some of the common errors that we're seeing out there where people are failing their meaningful use audits? And, you know, if it's not obvious you haven't heard, they are auditing meaningful use, people that have gotten money and for meaningful use. And if they fail their audit, in any one element of meaningful use, they have to return all the money. And by far, the biggest area they're failing is the risk analysis. People did not do a risk analysis or didn't do one that really was adequate. So what are the things that that are causing people to fail? One is checklist only. Like I've already said, that you can't just do a checklist. It's not a risk analysis. No inventory. They don't have a way that they're properly scoping the document where you understand where all your PHI is. It's compliance focused only. You can't just look at policies. You need to look at, you know, other factors. No listing or ranking of the risks. There's no recommendations for mitigating those things. And one of the big ones actually is that the risk analysis has to be done within the reporting period for meaningful use. So if all of you aren't aware, in 2014, for every eligible provider, eligible hospital, it's a calendar quarter that it's a reporting period that's a calendar quarter. So we're actually getting to the last third of the current reporting period, and if you are in your reporting period, you need to conduct a risk analysis and document it by the end of September if this is your current reporting period. By the way, if you're planning on doing a reporting period in Q4 of 2014, you could still conduct your risk analysis now because it can be conducted prior to a reporting period, but it can't be conducted after the reporting period. So if you're doing it now and you can't do your risk analysis in October, it has to be done in July, August, September. So one of the things that we knew is we actually have a little bit of inside information from Figliozzi and Company. That's the company that's doing these audits. And what are the things that they have, that we sort of know they're looking for? They want the document, the risk analysis, to reference ONC and HHS guidelines. They want it to adequately cover the risks associated with the use of certified EHR technology. They really prefer to see it done by an auditor or a consultant. It could be an internal auditor that has expertise or a consultant, but that gives them good feelings when they see that. They ask themselves, is this just a compliance checklist or an actual assessment of the risks, which we've already covered more than once. It's got to be more than the checklist. And they also look at the date. They did note that it can reference a previous risk assessment that shows improvement. So maybe you did a risk analysis last year, but now you're back into, need to do one this year. And that's why a review is allowed. And I'm going to talk about that in just a minute, but a review is definitely allowed. Where you can document changes since last year, and we'll talk about that. Now I'm going to talk about some self-assessment tools that are available. I am not a fan of these tools, and I want to make that clear before I talk about the ones that I will kind of recommend with some caution. One, none of these are intended for enterprises. They all were clearly developed, with one exception, but unfortunately that one exception is one that I don't recommend. But one is they're not intended for enterprises. They really were intended for small clinics. They're all hard to use. They aren't very good at identifying risk, which is the whole purpose of risk assessment. They really require expert knowledge to use well, and yet no expert that I know uses them because they have better methods to do it. They tend to be compliance rather than risk focused. And then the last one is that three of the four of these tools really rely heavily on NIST, the NIST framework. And what I like to say about them is that means that they both do too much and they do too little. So this is how they do too much. Especially the NIST toolkit, then I'm going to talk about the HHS toolkit and the HIMSS toolkit, all kind of rely heavily on the NIST guidelines. But the problem is the NIST guidelines are not required by non-federal entities. So in that sense, they do too much. But because they're so compliance-focused, they don't do enough. They actually don't do a very good job at identifying risks. So their tools, the HHS toolkit, you know, there was a lot about in the press when that came out this past spring. It is the worst toolkit on this list. It's not recommended. I actually have an article on my website that I would recommend that you review. Just do assessing the assessment, and you'll get to that article, and we'll send out a copy of that as well. Let me make a note here, but you know, it's just a terrible tool. And now the NIST toolkit is interesting. My main complaint about it, it actually has some interesting features, but it is incredibly difficult to use and incredibly redundant. There are two versions. There's standard and an enterprise version. The enterprise version has over 900 questions, and when you're going through it, you think, I've answered this question before. I've answered this over and over again, so I don't recommend it. The two that I recommend with caution is the National Learning Consortium tool that was developed. It was actually distributed quite heavily by a lot of the regional extensions in each of the different states. And I think it's decent, and then the HIMSS toolkit is decent as well, and you can find both of those by Googling. Again, recommend with caution. I'm not a big fan, but if you determined to do it yourself, those will help. Now here's my mini project plan for conducting risk analysis. Identify your team, inventory all the computers and hardware and copier machines that access, process, store, view, transmit protected health information, document information flows, network diagram and system boundaries, risk categorization, inventory all your interfaces, like where the data is coming in, where it's going out, policy review and mapping, do a security incidents review. So hopefully you've been documenting your security incidences and you use that as part of your process. Training materials review, do vulnerability scan and at least basic penetration testing. Wireless security assessment like WP, like we want to know, is it encrypted? Are you using an encryption standard like WPA2, hopefully? And we also want to know, how is it configured? Is it on the backbone of your corporate network? So maybe you're using encryption for guests, but once they're on the network, they're on your corporate backbone, and that's not good. So we would look at all that. Firewall, gateway settings, physical security assessment, like how are workstations positioned, and what are the physical barriers, and what's your locks, and all those kinds of things come into play. Contingency planning, leadership analysis really gets into like, okay, as a security officer, are you equipped to do your job? Authentication and access controls, encryption determination, what needs to be encrypted based on that reasonable and appropriate standard, transmission, so that's email, that's texting, things like that. Mobile device security is another area where you need to look at how your mobile devices are being used. And then you want to take that data and identify the vulnerabilities and rank them according to, as we said earlier, their potential and their impact, and then report on that. Now, one of the things that I do note is that the rules and even meaningful use and best practice clearly recognize that you don't have to do a full risk analysis every year. And what I recommend is that you do a full risk analysis every 2 to 3 years with a review in the intervening years. In the in-between years. So the one exception to that is if you have a significant change in your system or operating environment. Maybe you move to a new building or you go to a new system. All of those things are true. But for a review, the right way to think of it is it's iterative. Changes since the last risk assessment, document those changes, update the inventory, again, review any incidences that occurred and do root cause analysis. Changes to workflow might happen, that could be included. Do new vulnerability scans, both internal and external. Review of your prior assessment and see if there are any changes or issues that need to be addressed. one of the things is what's your progress implementing controls from your last risk assessment. So, you should have come away with a kind of punch list of things that you should do, and, you want to say, how have we changed? What have we done? What have we updated? And then document that you've done those things. And really, the rules themselves give you the best place to document those changes, and that's your security management plan. And then update the risk matrix and advise on additional security measures and as I said, the security management plan. So as we wrap up, we are getting to the end here. I'm going over a little, but we started a little late, so hopefully you'll bear with me. What I want to do now is talk about those two examples, an addressable safeguard and then something from the risk analysis, and then we'll open up for questions. So encryption is an addressable safeguard. That means the reasonable and appropriate standard applies. So how do you think about encryption and what you ought to do with devices and data in motion, etc.? You want to look at the class of devices, like laptops, because they're portable and they run on batteries, are riskier than workstations. Somebody literally could unplug a laptop and walk out of a building and still be connected to the network. So it's a riskier class of devices, and you probably should treat those differently. Mobility and physical security. As I said, laptops are more mobile. What is the physical security associated with a device? If something's in a data center, it's more secure than if something's in the reception area, for example. So data storage, big important question is what data is on the device itself. If there's no data on it, then that affects what you need to do from a risk standpoint. And then performance. If, let's say, for example, encrypting a database dramatically affects performance, that basically gets into what's reasonable and appropriate, and then also looking at alternatives. What are the alternatives that you could actually consider? So one of the examples that I would use is like, looking at something like a zero client or thin client. I am a huge fan of the use of thin client, zero client devices in healthcare. And they have all kinds of advantages in addition to security. So we'll talk about that, here as we go through this ranking of devices. So roughly, this is very rough, but roughly the most secure physically data is server in a data center. That still doesn't mean that databases shouldn't be encrypted, because hacking events could still happen, but we don't worry so much about the physical security of a server in a data center. Server not in a data center, maybe it's in a data closet that's locked, so that would come into play. Workstations with a thin client. So let's say you have a workstation, maybe it's at the reception area, but you've completely gone to a VMware RDP remote desktop protocol environment where there's very little or no data on the actual device. And in fact, if you're using true thin client hardware, there's not data on it, on the device. It's only working through a virtual environment of some sort. And so there's no data, and and that's an alternative to full disk encryption, is the use of thin clients. So what about non-mobile laptops with a thin client? So it's a mobile laptop, it's not carried off and around from building to building, from place to place, and you've got a thin client. Well, that's a pretty secure device. Workstations with a fat client. A fat client is where you have an application running on the device, that desktop or that workstation. So in this case, it's a workstation with the application running. And a lot of people say, well, but all the data is being saved to the server. All the data is being saved to the server. Well, yeah, maybe so, but in those cases, it's still being cached locally. I've yet to see a system that doesn't do at least a minimal amount of data caching when you have a client software running on a client device. So there's still a risk there. Mobile laptops with thin client, so it's only accessing it through a network. And then lastly, is mobile laptops with a fat client. And there's actually one other category, mobile laptops, there's an application running on there and it's being cached. I want to add a bullet 8 here, and that is, it's a client that's saving data locally. And there are some healthcare environments where that becomes an issue, such as home healthcare. home health care, they cannot have a reliable network in that environment, and so usually those systems are being used in the field, saving data locally, and then syncing later. Those devices, have to be encrypted, as do a number of other categories often, but that one you always want to encrypt because the risks are too big. So with that example, let's move to our last thing, and then we're going to be done and open for question. What about risks that are not regulatory? And the main example we're going to use here is Windows XP. Windows XP was sunsetted on April 8th of this year, and there were a lot of people that were saying, well, use of Windows XP is actually a compliance issue. It's like if you don't get rid of them, you're not compliant, and that's actually not correct. The regulations don't really address it. So what do we have to do? Well, really, you have to do what your risk analysis tells you have to do. So I'm going to use this. I'm going to sort of give you a scenario. Imagine two hospitals. Both of them have a breach associated with the use of Windows XP. So Windows XP is being discontinued. Those devices are going to become increasingly vulnerable as people are targeting them and trying to exploit those vulnerabilities. And one of them has the breach, they're audited, and they have nothing about Windows XP. They haven't done a risk analysis, they don't have anything in their security management plan. The second one, and that they are going to fail their audit, they're going to have to pay a heavy fine, all those things. Hospital B also has a breach associated with Windows XP, but they conducted a risk analysis. They documented those risks. They put it in their security management plan. They had a plan to mitigate the risk and to get rid of those Windows XP in 6 months, devices in 6 months. My point being is that I can't guarantee you that that Hospital B is going to, not fail their audit, but they are far less likely to not fail it, and in fact have a good chance of doing fine. So that's really the point, is that they took the efforts to mitigate those concerns. So this is a list of the kinds of things that they might have put into their management plan: repurposing XP machines, keep the data up to date. And I'm not going to go, you'll get this presentation, you could look at this list of things that client could have done with Windows XP. So closing it together, integrate these things into your business practices, automate as much as you can, applications, Active Directory, enable security functions, understand how your vendor can help you with these things, create and use checklists, and then consider outsourcing what you can't do yourself. And with that, I'm going to open it up to questions.
Thank you very much, Steve. Great presentation. That was very complete. I want to remind everyone, as we wrap up, to send in any questions that you have utilizing the chat window. And while we're waiting, I'll remind everyone also that we will post an archived version of this presentation on our website in the next few days at terakai.com/webinars. You can go there to view it.
So are there any questions?
It doesn't appear like we've had any questions, Steve. I think you did an extremely good job, and we really appreciate it. And thank you again for this presentation. Oh,
it was my pleasure. I take a pretty healthy pace, but there's a lot of stuff to cover. And again, I do want to encourage everybody to go to healthsecuritysolutions.eventbrite.com, and we do have this HIPAA 101 where we go more deeply into the actual standards that I think you might benefit from. So, but thank you for your time, and thank you for hosting this.
Okay, and thank you for everyone for attending the webinar today, and we look forward to talking with you again soon. Have a great day.